What is up, everybody? Jeremy here. And guys, I'm very excited for our interview today. I have Dr. Simon Maltais with me, and he's worked for a long time in healthcare in Canada, and now he's actually working in the US. And he is a world recognized cardiac surgeon. He's literally one of the top in his field. And he's also the author of a book called Healthcare Anonymous: Put Yourself First to Avoid Anxiety, Addiction, and Burnout, because he's really trying to help healthcare workers that are just overworked. It's crazy to me that the people that we look to keep us healthy, because of the demands of their career, just aren't being given that themselves. So Dr. Maltais, thank you so much for hanging out with me today.
Yeah, of course. Good morning.
So I want to find out first and foremost is like addressing the particular subject you are like how did that happen for you? Like, how did that become something you noticed and you're like, I'm going to do something about this, right? Because there's a lot of things we notice in our life and we're like, wow, that's not a great situation, but I'm not motivated to do anything about it. I guess what's caused that for you?
Right. Well, thank you, Jeremy. I think that one of the pieces that was a key for me is, I had got to these positions where I was top of my game, peak of my performance, very busy, but yet I was still unhappy personally. And as I guess as the pandemic started to be more of a problem the last couple of years, we've seen more and more of my friends and colleagues sort of getting sick, and so it became sort of a calling for me to start writing about this, and how the people that are healing others are gradually getting sick within the system. And so yeah, it started to write one day and then decided to continue, and then led to a book, I guess.
Well, I'm curious because I know I've found this myself in doing writing. I find that the process itself was actually kind of a big transformation piece for me because it helped me to clarify a lot of my own thoughts. It even changed some of my viewpoints. I'm curious, like by delving into actually writing it and explaining it, what was that process for you personally?
Yeah, I mean, we're used to getting up as surgeons, right? We early. Now I got even earlier and started to write every morning, 15 to 2,000 words before going to work, reaching out to collaborators. In some ways, Jeremy, it was a therapy for me. It was thinking about my own life, my own struggles, what I went through, and then reaching out to my colleagues, and not only just doctors, but healthcare providers like nurses or technicians, or even people that have just been in touch with the system, in general, and then hearing their stories and putting it all together in two different countries. So that was also a bit of a awakening to me, to understand that these struggles, irrespectively of the system that you're in, are there.
Well, that was actually my next question for you. You have worked, I guess, in both systems, and I guess just for you as a doctor, what was your experience like, I guess working in Canada versus working in the US? Because it's, they are set up differently, they are structured differently. I guess what was that experience like for you in terms of how you cared for your patients, but also like, how it was on your own hours and stress and things like that?
Right. The financial system apart, I think the bigger difference is of course, public versus private sort of access to healthcare. From a surgeon's perspective, I guess what people experience, at least in Quebec, where I'm from, as opposed to other places in the United States, is waiting time, just because everything's free. And so for a surgeon, it's difficult because being used to the U.S. sort of pace, where patients are getting admitted. If they have an emergent condition, they get treated rapidly, or they go somewhere else. People are more sort of waiting in Canada. So that was a difficult adjustment for me. And then the pace is probably a bit different. As a surgeon, I worked in world leading institutions with high volume practice at times. And so that was the sort of constant need to be there, from 6 a.m. to sometimes midnight, to treat patients, and doing the same thing over again. That's been a challenge. A lot of cancellations. That's hospital dependent and a bit, where you're working, but a lot of cancellations because of resources.
Hmm.
I found probably a bit more frequent in Canada and Quebec, particularly because of COVID as well.
Hmm.
But that has a certain impact on the physicians, because you prepare for a surgery, you have a certain bound with the patient, but also there's a financial aspect to it where
Sure.
you do surgery, you don't get paid, so that's a bit of a stressful uh, thing as well. But yeah, major differences, subtle
Hmm.
but important. Yeah.
Well, I guess like looking at the system as a whole, you've called you've talked about the problem before as kind of the healthcare disease in certain ways.
Yeah.
When I guess when we're looking at a system that keeps people well, why are the people that are taking care of us like not being, I guess given the same ability to be human and be treated well and things like that? They're kind of being, run down in a lot of ways, I guess, when you look at that system.
Right. I think it's multiple prongs, but working in a high intensity environment in general, I know in your line of work or any police officers or athlete, you sort of
Hmm.
tend to be in a system where it always requires more out of someone. And it's not only just at the moment where you are physically doing the activity of
Hmm.
surgery or playing sports. It's also the culture getting you there, right? It's sort of the system, the models you have over the years to say, okay, this is how I need to look like when I'm a surgeon, not only just from people you work with in training, but media sort of projection of what a heart surgeon should be.
Right.
Refer in the book of to what image you have growing up of a heart surgeon, and they're pretty much always angry people on these shows, and very talented but angry people. So you
I
become
watched a lot of Grey's Anatomy, and everybody wasn't that angry, but it definitely was stressful in a lot of ways.
right, and so you end up growing in this system, and the patients are there. There's a lot of suffering. You end up want to give more, but the reality, Jeremy, is you can never sort of attain this perfection where everybody's doing well. And so then the consequences of that in a perfectionist mind is to have to live with failures at different degrees, or have to live with suffering, and then putting a lot of this sort of guilt on you, and it progressively sort of adds up to a point where I think manifestation of what I call healthcare disease. You were referring this is basically so this imbalance, or this sort of inability to cope from a professional and personal life with your work setup. And work it's one thing if you can get away from it, but if you work every day in it, that's a bit of a stressful and sort of chronic system. And the only way, in my opinion, to start sort of getting away from these catastrophic things like depression, burnout, anxiety, is to start taking a pause and understanding where you're at in the process, and really kind of taking a step back to analyze your practice and what's best for you.
It's interesting because I think, and I don't think I thought as deeply about this until we're having this conversation now, but I feel like it's almost like we're putting unrealistic demands on a lot of our doctors and surgeons and people like that, right? Because like, if any one of us, had somebody that we're working with pass away, or something like that in regular life, like it would be a life stopper. For doctors, like you experience things like that every single day, or several times a week, and a lot of times we ask you just to keep going without even addressing, I guess, the mental health aspects of it. I guess, what is that toll of it, like that, like I guess in ways you deal with death and disease on an everyday basis, and you're asked to just keep going.
Yeah, it's you don't get trained to deal with that, and that's a
Mm.
that's a difficult aspect of what we did. It's a forgotten one. In heart surgery, when things don't go well, people die, or have catastrophic complications. You do have to build yourself sort of the capacity to be empathic, but in some ways detach yourself from the situation. and
Mhm.
and the danger with that, Jeremy, is to sort of get away from it, and at some point just pass by, right? Or don't care, or just be in a way where you individuals become diseases as opposed to persons and things. And so and so there were weeks and times where in my career, being busy and things, you can deal with 1 or 2 death a week, or every 2 weeks, and some are predictable, some are not. So a lot of suffering. So you end up building yourself a little bit of a shell to deal with it, but it all comes back, right? And so at some point you can sort of live through it a certain time, and it sort of comes back to be manifested in some sort of way, either whether a personal issue or professional issue, going to be angry at work, or sort of like have financial issues, or start drinking, or experience burnout, don't sleep well. So all these, the point is, when you get to these symptoms, it's not something that happened yesterday. It's a process through which over the years you've sort of coped in a certain way that was good or bad with what you had, and it ends up manifesting itself. And the rate of depression, and that's known facts, right? The depression, burnout, suicide rate among doctors and healthcare worker, especially now, is extremely high. And then the culture in our system is not talk about it, right? I know in heart surgery, when you were going home after a call, it was a sign of weakness, right?
But that seems like almost one of the worst things you could do, right? To just kind of like sit on that and not talk about it. Like I don't know that you always want to talk about it with your family, because that can't always be pleasant for them, right? But like, I think there has to be an ability to discuss it, because at the same time, if you bottle that up, like, one day you're going to go off. You know what I mean?
Right, you're right. And family is one thing. I mean, you want to keep this a bit separate from your family. When
Sure.
my previous mentor, you say, when you have to be, when you come out that door and come in that door, you got to be like a rock and sort of close it out. That goes a certain time too, right? You need to have confidence. You end up having people you affiliate with, and you can cry on, or sort of talk about your day. But it is important to get that, to keep that sort of point where you protect your life and your family from it. And that gauge is not easy to put together. It's hard to sort of for each individual, it's different. Where do you put sort of that balance? For a lot of people, being a doctor or being in healthcare is all they have, or all they are, right? And so that makes it very difficult to put this gauge somewhere. And so and then it's a learning process, and that's what we're trying to accomplish in the book. Try to have a way for people to realize that putting this sort of stop is important.
Well, I guess, Dr. Malte, looking at physical demands, because to me that seemed like, I guess, the most obvious one. The things that we've kind of been talking about, I think, are the thing that a lot of us just don't even consider, like, I guess, things that you deal with every day. But like the physical demand, like, I don't know many careers that physically expect from you what outside of maybe police work, what being a doctor or a medical professional ask for you. I have a friend that she's a nurse, and she works 12-hour shifts, sometimes day shifts, sometimes night shifts. Her husband's a police officer. He works 12-hour shifts, sometimes day shifts, sometimes night shifts. That's a hard life. Like, I don't understand, like, how you can be expected to work and be at your full potential and full ability for like even shifts like that. So I guess looking at that toll, what is that like on a healthcare worker?
It's difficult. Jeremy, I'm 42, and I'm seeing every week somebody because of back pain. You end up, operations can go on from 6 to 12 hours. If you walk on hard, wood floor, or hard, floors every day, the type of shoe matter, little details becomes very important. And it takes a toll, and that's a side of the call schedule. Whether you're a nurse or a doctor, you get calls, which is often a weird concept, because it's not only just sleeping in a dorm room in the hospital. You're up all night, and then you sort of have to deal with the stress of that, which in a lot of addiction books, or they say, well, if you want to get away from your addiction and your problem, never be hungry, never be angry, never be alone, never be tired. Well, that's the definition of of a call schedule.
Right.
You eat off a little piece of toast on the table. You deal with more suffering at night. You are constantly tired, and you're pretty much alone at night. So is the definition of feeling a certain way in and so it's difficult, and most people will take a toll. And for some people, especially within the pandemic, where you wear a mask, where you sort of confined to these sort of rules, and tremendous amount of suffering, it is going to be for them a wake up call to say, I'm just done with this. I just can't do this any longer. And all the sort of opinion of the society on the vaccine and no vaccine aside, which plays a lot into our ability to either care for people or the perception that we have caring for people.
So let me ask you this then, Dr. Maltais. So this is the problem we're seeing. We're seeing, all of this stress on healthcare workers. We're seeing, being told not to bring it home. So it's kind of like you don't really have an outlet a lot of times. It makes it difficult. I could imagine even like keep a fitness schedule up a lot of times. So how do we address this then? How do we solve these problems? Because these seem like they're pretty, I guess, deeply rooted in how, not just how the system's structured, but also how the culture around it's structured. So I guess, how do we change the conversation? How do we do something about this?
Right. That's a key. That's what I hope to do with this book, so to help as much people to speak up about it. I think the first step is to realize that has an impact. The mental illness and healthcare and is a critical aspect for not only just the workers, but also patients, right? I mean, you wouldn't want to have your heart surgeon, out of a night out drinking or on 3 different pills for anxiety and depression, right? You want to have your doctor at the best of his game. And so for departments, this hospital, it's to realize and invest into mental illness. And then that means, understanding not only just, pointing fingers and to say, okay, you're depressed, we're going to put you on 6 months leave, come back when you're better, but really invest into understanding what can we do to help people within the system. So it's hiring more people. Of course, that's always somewhat difficult. It's acknowledging the hours. It's acknowledging that that's present within the system. It's also injecting resources for, there's hospitals and places that are a bit more forward, but having a gym or having meditation in the afternoon, offering some good food at lunch. And that sort of translates into a lot of the enterprise or Google companies have sort of taken that sort of step to help their employees. Healthcare is a bit behind in that regard. And I think, of course, you can't do it all, but having a acknowledgement or making the workplace perceive that that's important for the leadership becomes a very important aspect of it. And even further than that, I would say earlier on in your career or in training in medical schools, having sort of a proactive way to address mental illness, or for people to perceive their own sort of pathway into medicine. Because for some, being a heart surgeon, yeah, it's kind of cool. It's fun to say when you're in with friends. But it may not be the best course of action for you to pursue, right, in medical school. So you may be more suited if you're an anxious, sort of egocentric person, like some of us. Maybe you're better directed to a different path. So it's even like sooner, into training, sort of having people realize that has to be part of the conversation.
Well, I think in some ways, you have to have enough ego to have the confidence in yourself to do some of the things you do as well. Right? Like it does not take, a sheepish person could not handle some of the heart issues you handle. You know what I mean? Like you do have to have a level of confidence at the same time to handle that.
Yeah. I mean, there is a fine line. One of my previous mentor used to say that there's a fine line between confidence, overconfidence, and arrogance, right? So there's a bit of, and that also, you don't get teach how to do that. You sort of look at Dr. Austin from The Resident, and you say, this is how I need to be, like overconfident. They used to say never hesitate, but sort of always do something. But you should never be in doubt when you do something as a surgeon. Sometimes wrong, but never in doubt, right? But that's not something that should be repeated, right? Outside of the, but that's the things that we hear, and
right.
and the culture needs to perhaps change, because I don't think it's all bad. I mean, I don't want to sound as someone who's resentful
Mhm.
of the system, but I do feel that, especially with the pandemic, it has really pointed a finger um, on that aspect, and how for years to come it will be critical for people to realize the impact of mental illness and exhaustion within the system and the cost of that, right? Yeah.
Do you think that like and I don't know if this is a question you want to answer. If you don't, that's fine. But like, do you think the profit structure of a lot of these hospitals aren't set up in a way to consider, just the human aspects of doctors like yourselves, because they're looking at, dollars in, dollars out. These are things, we're either wasting money on or can't afford. Like, have you seen that as a problem? And if you don't want to answer that question, I totally get it.
No, Jeremy, this is an important, I think, aspect. Although it's
Well, because
hospitals.
I say that because I look like here in New Jersey, like, there's like one company that owns every hospital in the state. So it's like they're major conglomerates that are just looking at dollars in, dollars out.
Right. Every hospital is different. I would say in the last, I mean, I've been in practice for almost 15 years now. And like the last 5 years, or 5 to 10 years more specifically, there's been a huge emphasis on the importance of coding and electronic medical records. And that's all linked to sort of billing and how much money you get from a patient, particular patient's sort of illnesses. And while that's important because that's how hospitals make money, it puts a tremendous amount of pressure on the doctor and the nurses for charting. And so the amount of electronic records you need to fill and paperwork, and then the emails you get afterwards, are you sure this is it, what do you complete this, it has crowded our system. And that's for a lot of places that becomes a real detractor. And you're right. I mean, some hospitals, especially now in the last 2 years, it used to be, how many cases you've done. It used to be, how many type of surgery you've done. Now it's a variation on the percentage of money you've generated or cases you've done every month, and then objectives at the end of the year you need to meet. And so I've seen places that have stopped vacations, that have sort of canceled traveling for you, for meetings and things, so you can reach that sort of level. And so, as I said, I think there's a need to sort of get away from those numbers. And the only sort of impact it has is it puts the stress on the workers, right? See more people, chart more, be more accurate, and then just do more surgeries. And so that, as we said earlier, one way to get away from it is to hire more people. But on the other hand, if the system is sort of pushing you to do more,
Right. They're trying to save money. So they want you to do more and they hire less people.
Right. And so I think that's a real moving point. It's very complex. I was just reading this article in Time Magazine about healthcare cost and changes over the last 20 years. It's very complicated and maybe driven by insurance a lot. And so, especially in the United States. And so where a lot in some states, I feel like insurance really controlled, especially in California, for example.
I know it's a huge barrier. Like in 2012, my mom had a stroke, and like a lot of her care needed to be right away, right? Like a stroke is something you need to do stuff fast. And the thing we ran into is everything was going back to an insurance company to make decisions and not letting our doctors make the decisions. And that gets really tough when there's somebody telling the person that's here working with the patient, that knows the patient, knows the case, you can or can't do that. It's like, just let them do their job.
Yeah, and then you were talking about Canadian versus US system. That's something I haven't seen in Canada, where the
So in
system is.
Canada, they don't get in your way. They just kind of let you do what you need to do.
Yeah, it's the government sort of based thing here. I mean, even was at the bedside of a patient, I seen him, and I had a call from administration saying, well, you're not part of this HMO insurance, so we're going to have to wait for the other surgeon who's 2 hospitals away, 30 miles away, to come and do the surgery. And that's okay, because I think from a patient perspective, it's better, right? So you don't get flagged with a huge bill at the end of the day, but it has a certain impact on care, for sure.
Well, I think we've definitely hit on a lot of important issues today, and I hope for a lot of people this is a wake up call, Dr. Maltais. I really appreciate what you're doing, because there should really be more attention and more care for the people that are keeping us healthy and caring for us. So, once again, The book that we discussed today and that people can be expecting to be out very soon is called Healthcare Anonymous: Put Yourself First to Avoid Anxiety, Addiction, and Burnout. So for the people listening, if they want to find that, if they want to find out more about you, where's going to be the best place for our listeners to go?
Yeah, well, thank you. I'm super excited about the book. I think it's going to help a lot of people. Healthcareanonymous.com is where they should go and look at more details at the book. Of course, they will also find there there's steps recovery program that it will be sort of simplified in a workbook. So if they want to buy the book and get a sort of a free workbook assessment. I think that's going to be, to me, I think it will have an impact on what we're trying to accomplish. And the more people read the book, it was a humble sort of way for me to start a movement, perhaps. So I'm excited about it.
Well, Dr. Simon Maltais, thank you so much for your time today, sir.
Sounds great. Thank you.